depan pun. Gila ni macam kerja. Ada orang tau. Ada lah. Ada orang. Tengok.
Tak nak tengok kena ikut orang sini.
Tak, sana. Tu ada orang tu.
Ada orang tu bang. Benda ni panjang tau bukan bilik. Allah. Gangam jatuh depan mata tu. Depan mata tu.
And that's his disaster. On 14 December 2019, a construction crane has collapsed on Bandar Baru Sentul, Kuala Lumpur, injuring 4 people including 3 months baby. The baby suffered a broken legs, but all had been confirmed to be in stable condition after being sent to Kuala Lumpur Hospital for the treatment. The Star Online posted, according to the data of Social Security Organisation SOCSO, there was an increase in the number of accidents and death in construction site. President of Malaysian Trades Union Congress, MTUC, Datuk Abdul Halim Mansur said, besides amending the law or imposing the penalties, Department of Occupational Safety and Health, DOSH, need to conduct a more frequent check on construction sites in the nationwide. It was reported that DOSH has overseen almost 14,000 active construction sites that has only 100 of safety officers. Did you know that there were 6,562 work-related accidents reported in Malaysia in the end of October 2019? And this puts our national occupational fatality rate at a staggering point of 4.14 times, that is 20% higher than Colombia. And these are just the cases that will be reported to DOSH. So what about those that have been not reported? Assalamualaikum warahmatullahi wabarakatuh. My name is Amar Afif bin Rizal, Bachelor of Business Administrations, Finance, currently taking HRM course in Group BA 242-2A. And now, I'm going to tell you why occupational safety and health plays important role in workplace in ensuring all the standards have been complied and observed carefully to reduce potential hazards and furthermore enhance the strategic improvement of human resource management. The role of occupational safety in Malaysia has been existent since 120 years ago, late in the 19th century. It started with the steam boiler safety and then followed by the machinery safety, and after that continued with industrial and hygiene, and lastly occupational safety and health that covered every working sectors in Malaysia. Occupational Safety and Health Act is an act which provides the legislative framework to secure the safety, health and welfare among all Malaysian workforce to protect them against risk and safety on their health. This act was gazetted on 24th of February in 1994 and is a practical tool on existing safety and health legislations. So the aims of these acts are to secure the safety and health and welfare of a persons at work against the risk arising from activities of a persons at work. Second is to promote an occupational environment for persons to work which is adapted to their physiological and psychological. The provisions of this act are based on self-regulation schemes, so it is a primary responsibility to ensure safety and health of a work lies with those who create the risk and those who work with the risk. This concept of self-regulations encourage cooperations, consultations and participations of employees and management in efforts to upgrade the standard of safety and health at the workplace. The Occupational Safety and Health Act 1994, we call it as OCCUP, is enforced by the Department of Occupational Safety and Health, or we call it as DOSH, a government department under the Ministry of Human Resource Malaysia. So DOSH will ensure through enforcement and potential works that employers, self-employed persons, manufacture and all working related to practice a safe and healthy work culture and always comply with existing legislations, guidelines and codes of conduct. So DOSH also will formulate and review all the legislations, policies, guidelines and code of conduct pertaining to occupational safety, health and welfare as a basis in ensuring the safety and health in Malaysia. National Institute of Occupational Safety and Health, NIOSH Malaysia. So NIOSH Malaysia is a company limited by guarantee owned by the government also. The words of Minister of Human Resource. NIOSH will be the critical catalyst in promoting the occupational safety and health that also serve as the backbone to create the self-regulation occupational safety and health culture in Malaysia. So NIOSH Malaysia conducts regular occupational safety and health related trainings around the country as the arm of Department of Occupational Safety and Health, DOSH. The courses offered by NIOSH are recognized by those departments. NIOSH is in the positions to assist the industry in achieving the aim. So they complement the government effort by providing training, consultations, and so forth. They also undertake the research and development activities that will assist in the development of occupational safety and health in the country. So their mission is to become the partner of industry towards full occupational safety and health compliance. Employers and employees also play the important role in ensuring the safety of a workplace. Let's take a look at the responsibility of employer. First is to prepare a safety and health policy. According to the Section 16, the OSHA, it is a duty of the employer to prepare a safety and health policy. Aside from preparing such policy, they must also update it as often as necessary. This means that if your company has a safety and health policy from 1990, it might be the time for you to take a look to it again. A failure to have a safety and health policy will result in the very steep fines of the employer. So this is provided under the Section 19, which states that a person who breaches the provisions of this Act shall be guilty of an offence and shall be liable to a fine not exceeding 50,000 ringgit or imprisonment for a term not exceeding 2 years or both. Second is provide a comprehensive safety and health training. So another role employed is to provide the workers and managers with a greater understanding of the safety and health program itself so they can contribute and development into the implementations. It covers the knowledge and skill needed to do their work safely and avoid creating hazards. Next is creating awareness and understanding of workplace hazards, how to identify, report and control them. Last is specialized in training. Specialized in training if their work involves unique hazards. So effective training education can be provided outside the formal session setting, like peer-to-peer training, on-job training, and worksite demonstration can be effective in conveying safety concepts. Under Section 24 of the OSHA 1994, employees have a certain general duties that they will have to obey as well. So, if you are an employee, you are responsible to take a reasonable care of your own health and safety at your work. So these include taking a reasonable care of health and safety of your colleague that may be affected by your actions. It means that if your employer clearly told you to stay up from the 3rd floor of a corridor because there is a giant 3-headed dog resides there and you still decide to go there, so you can't blame your employer for failing to provide the safe working environment. Next is to cooperate with your employer. So cooperation with your employer is basically not imposing on his way whenever he tries to discharge the duties that have been given to him by the law. For example, if it's an obligation for you to keep all the fire exit clears and you decide to leave your bag in the way despite being told of many times, you will be guilty of an offence. Next is to wear the personal protective equipment. So what the law is trying to say is that you should wear all the protective and safety equipment or clothing that have been provided by your employer. So for example, if you were working in the construction area and refused to wear a safety helmet and vest that was provided by your employer, you cannot blame your employer if you get a head injury from falling the debris. There are few measures in promoting a safe work environment. So first is enforcing the safety by the appointing of a safety and health officer. He or she is responsible for ensuring that there is a safe working environment for employees and other relevant parties. So a safety officer is responsible for tasks such as developing, implementing and improving health and safety plans, programs and procedures. Next is identifying occupational health and safety related training needs in the workplace by conducting a safety inspections and risk assessment. And lastly is to reporting on occupational safety and health related activities and supervising junior health and safety employees. So next is employee must be established a safety and health committee different from safety officer. It is often act as the liaison between the senior management and employees. It is responsible in assisting the safety and health officer. So, a health and safety committee can be an important way to improve conditions on the job. So, this committee provides a forum for employees and management to work together to solve health and safety problems. An effective community can help to prevent injury and illness on the job and increase awareness of health and safety issues among workers. So, health and safety officer and committee work as a team together to ensure that all the relevant health and safety laws and regulations are complied within the workplace. Apart from that, a measure on promoting a safe working environment is to investigating the worksite incident. These provide employers and workers the opportunity to identify the hazard in the operations. Incident investigations are often conducted by supervisor, but the most effective is this investigation should include managers and employees working together, since each other bring different knowledge, understanding and perspective to the investigations. Addressing underlying or root causes is necessary to truly understand why the incident occurred, to develop a truly corrective actions and minimize or eliminate serious consequences from severe friction.
Although there are various of efforts provided by NIOSH and DOSH, companies must not solely depend on them. Instead, companies or all parties must show their support and commitment towards the goal of full implementations of occupational safety and health. I hope you guys enjoy the presentations and learned a lot about occupational safety and health related issues. May all these informations bring benefits for you in future. With that, thank you and Assalamualaikum. Panjang dia.